Welcome to the Doc Gallagher Radio Highlights. Doc is on the air Saturday mornings at 10 a.m. on KAAM Legend 770. Got a question or a comment for Doc? You can reach him at 1-800-GFG-4DOC. Now, here are some highlights from one of Doc's top shows.
It has been documented that residents of nursing homes who have frequent unannounced visits, random visits, get the best care because the nursing staff doesn't know when that loving sister, daughter, son, grandson, pastor, lawyer, CPA, financial planner, someone who loves that person, they don't know. The nursing staff doesn't know when you're going to pop in, so they will make sure that they are properly groomed, that they are appropriately medicated. Appropriately, we'll talk more about that here in a minute. This is Doc Gallagher. We're talking about the 9 most common mistakes. The 9 most common mistakes, 9 most common problems with nursing homes to make sure it doesn't happen to you. 9 most common problems with nursing homes. Number 3, that the resident is not taking bathroom trips as needed. And frequently that's because the support staff says, oh no, not again. It's too much trouble to get them out of bed, help them walk them to the potty, or if they're totally immobile, to get them in a wheelchair, or to use the appropriate bedpan. Our elderly loved ones need a lot of attention as they get older, as we get older. Here's the challenge with that. Without those frequent bathroom trips, then we are being specific so that you can specifically know how to prevent your loved one from being endangered. Without the necessary bathroom trips, we have incontinence. Incontinence means wetting the bed, means wetting your pants. With incontinence, that leads to sores. I would tell you some of the stories out of government reports of people who were not taken care of who were incontinent. But you can get that in my book that exposes the abuses in many of the nursing homes. Without that, without the necessary bathroom trips, there is incontinence, which leads to sores, which are painful and lead to infections, which are painful and dangerous. The next common problem is not enough fluids. This is a test, a 2-question test. What are the 2 greatest causes of death in a nursing home? Old age is not one of the answers. Neither is Alzheimer's. The 2 most frequent causes of death, premature death, are dehydration and malnutrition. Not enough fluids. Signs of that, obviously, a continuous clamoring for water. I'm thirsty, I'm thirsty. Again, with some support staff, the answer is, oh no, not Mrs. Smith again. Oh no, not Ralph again. They just always do that. One of my clients told me every time she came in, mother said, I'm thirsty, I'm thirsty, I'm thirsty. She went to the nurse's station, they said, oh, she just says that when you're here. So she had a doctor come in and check, and sure enough, her skin dramatized that she was seriously dehydrated. Without proper hydration, you can see it in their lips. Their lips get cracked, their skin gets dry, and it leads to premature death. The 5th one, closely related to this, is malnutrition. Malnutrition. It takes effort. It takes effort to get that elderly person to eat properly. You've got to have the patience to sit in the room with him or her to make sure that they're eating and swallowing. A lot of support people in nursing homes don't have the patience, don't want to fool with it. And they don't care if they eat or not. Obviously, that leads to malnutrition, which expedites an early and painful death. Obvious symptoms are continuous weight loss. You could also see that happening by, again, cracks on a person's lips. And obviously, malnutrition leads to premature death. Going back to our first couple of items, if you just stopped by in the last few minutes, one way to prevent this is by making sure you make random and frequent visits to that nursing home or long-term care facility. You know, all things being equal, all of us would rather be taken care of at home, period. We all want to, you know, like Norman Vincent Peale said, we all want to die at home in our own bed with our loved ones around us, relatively pain-free. That's a given. How do you do that? Well, you do that by practicing the physical and financial strategies that I outline in my many books. The financial strategy includes making sure that you build a portfolio where you don't lose principal, and that you do take out long-term care insurance. So when the time comes, your family can afford home health care. Your spouse cannot take care of you in your final years. Your kids cannot. They will collapse into chronic fatigue and they will be dead before you are. That has been documented. So you practice those preventative measures, financially and physically, to make sure that in your final years you are able to pass away in relative peace at home, in your own bed, with your loved ones around you. That's what you want. We're talking today about those folks who didn't take those preventative measures and have been forced to go to a nursing home. There are two ways to go to a nursing home. One way is through Medicaid, which is welfare, which is a disaster. Don't plan for it, because it is drying up. Right now, 60% of nursing home patients are on Medicaid. The demand for Medicaid is getting greater, the resources are getting smaller, and the government encouragement, or the government willingness to provide for Medicaid is getting less and less responsive. We have a perfect storm developing with Medicaid, and Medicaid patients do not, in many cases, do not receive the same quality care as someone who was on private pay. What does private pay mean? Private pay means paying for it through your own long-term care insurance. Living without long-term care insurance is like driving without car insurance. When you do require that professional care, home health care, assisted living, nursing home, you want private pay that comes through your own long-term care insurance or out of your own pocket, or a combination of both. Because if you have to collapse into Medicaid, you will, in many cases, receive inferior care, documented by many of my clients who work in nursing homes and who refuse to have me tell you who they are or what the nursing homes are, for obvious reasons.